Well, this is going to be a relatively short module since it only covers 3 categories of medications. Those that work on the urinary system, the upper respiratory tract, and the lower respiratory tract. The drugs in this unit should be familiar to you since they treat common health problems, including incontinence from an overactive bladder, asthma, and chronic obstructive pulmonary disease, or COPD. You will begin by learning about oxybutynin, which is an antispasmodic that calms the bladder. It does this through anticholinergic actions. Remember these from Module 8 and the anticholinergic drug atropine that we discussed? Since anticholinergic side effects can be noticeable with oxybutynin, reviewing these effects will help you recognize their clinical presentation in your clients. In the second portion of the module, you will learn about drugs influencing the respiratory tract. Before you start to study these drugs, review the structure and function of the respiratory system in your textbook. Drugs that act on the upper respiratory tract may be found over the counter, and some of you have probably taken one of these medications, such as an antihistamine, at some point. You will also learn about drugs that treat pulmonary obstructive diseases. These include COPD, or chronic obstructive pulmonary disease, which is typically caused from chronic inflammatory changes in the airways, such as from cigarette smoking, and asthma, which results from hypersensitivity or allergic type reaction that causes inflammation in the airways. Both of these conditions result in narrowing of the airways, or bronchoconstriction, with resultant difficulties in breathing. Consequently, medications that treat COPD and asthma work to open up the airways, and these are called bronchodilators. So if you remember back to our neuro unit, these drugs are going to stimulate the adrenergic beta-2 receptors that block the cholinergic muscarinic receptors to dilate the bronchioles. Medications that are used to treat COPD and asthma are so important to learn due to the prevalence and fatal outcomes associated with airway disease. According to the CDC, obstructive airway disease is the 4th leading cause of death in the U.S. What's even more frightening is that 1 in 13 people have asthma, and each day, 10 Americans die from asthma. Sadly, many of these deaths are avoidable with appropriate treatment. That's why your nursing care is so important. Based on the knowledge you will gain in this module, you will be able to educate your clients to properly use their medications so as to live with their chronic disease and to prevent dire consequences due to ineffective management.